It's nice to see everybody with their summer coats. All set. Well, thank you everybody for joining us for the latest healthcare action update. I also want to thank Dr. Parfrey, the Deputy Minister for Health Transformation, and Melissa Coish, the Senior Director for Primary Healthcare and Community Services with the Eastern Urban Zone of the Newfoundland and Labrador Health Services. Today's update is about a new way in which we are improving access to healthcare for the people of the province. And I'll get to that in just a moment. But just a quick update. As a result of the department's recruitment initiatives, in the past month, more physicians have agreed to practice in Newfoundland and Labrador communities, including Bonavista, Springdale, Fogo, and the Bjorn Peninsula. As well, we've had a physician who's agreed to offer services via virtual clinics at Bishop Falls. Our specialist initiatives have also seen successes. 126 total joint replacement surgeries, 71 hip and 55 knee replacement completed since December of 2022 at St. Clair's Mercy Hospital as outpatient procedures. The goal of this initiative is to perform 20% of the annual volume of joint replacement surgeries, which is approximately 200 cases annually, as outpatient procedures, and the Newfoundland and Labrador Health Services are on track to meet or exceed that goal. This means that patients get to go home the same day. It frees up acute care beds so that other individuals can utilize those beds. 62 patients were transported. As of yesterday, we added another 8. So it's actually 70 patients transported on 9 flights via same-day fly-in, fly-out services from the health authorities' western and central zones for cardiac cath procedures. Those procedures are done in St. John's, and based on the success of these flights, Newfoundland and Labrador Health Services is working to schedule these flights on a regular basis and for more procedures. Since January of 2023, 67 joint replacement surgeries have been completed in St. Anthony by the Travelling Orthopedic Program from St. John's. This initiative has the potential to book more than 120 patients per year from our wait list, which may include patients from across the province. This is in addition to patients who've had surgery completed by the orthopedic surgeon in the St. Anthony area itself. We are also adding Carbonear this coming fall to that program, and we're looking at enhancing ortho services in other regions of the province. What this means is these innovative programs have improved access to care for patients who are clinically eligible. There have been over 100 times when a hospital bed that traditionally would have been used by someone recovering from surgery and was made available for other patients. These programs have decreased expenses for families and support persons who would have ordinarily had to travel and stay in the St. John's region as well. And now we are setting out to do the same with primary health care. So what is new today? Our government and the Newfoundland and Labrador Health Services are establishing mobile clinics in the central and eastern zones of the province. These mobile clinics are teams of healthcare professionals, including nurse practitioners, registered nurses, clerical staff, and family physicians. They travel to communities in the province where there are healthcare challenges, such as a doctor or nurse practitioner shortage. They will help meet the needs of people in the region who require primary care. The mobile clinics will provide that primary care, for example, access and availability to treat common ailments, educate and promote awareness of chronic diseases and management, as well as provide preventative screening. Patients can also be referred to additional services or facilities when required. The introduction of mobile clinics has the ability to reduce cost, increase efficiency, deliver high-quality primary care in an innovative team-based model, shift the focus from a reactive model to a preventative care model of health and wellness, and offer a unique opportunity for recruitment and retention for individuals who may want to work on these mobile clinics, and strengthen community engagement and connections. We recognize that the mobile clinics will be new to most people here in this province, but we have put in place best experiences and best practice from other locations because they have been used elsewhere with success. We are hearing good feedback from people who've experienced these mobile clinics as a method of providing access to primary health care. This is about supply and demand. We know where the demand is, and this will help us meet those healthcare needs. Today's announcement is another innovative initiative by government to expand access to primary health care across Newfoundland and Labrador. Our mobile clinics are an addition to the plan to establish an additional 11 family care teams that was announced in this year's budget, bringing the total to 19. The urgent care clinic that was announced in this year's budget, as well as virtual care expansion for primary health care services. The many recruitment and retention initiatives that we've made available for healthcare professionals as well. These are just some of the important actions that we're taking to improve healthcare. All of these initiatives combined together will provide a stronger, more stable healthcare system for years to come. And to keep up to date with the Healthcare Action progress, please visit healthcareaction.ca. I'll now turn it over to Melissa to provide details about the mobile clinics.
Thank you, Minister. We at Newfoundland and Labrador Health Services are excited to bring mobile clinics to the province. Mobile clinics are used across Canada to increase access to primary care. They are particularly effective for underserved and vulnerable populations such as people with lower income, people who don't have access to a vehicle, people living in remote or rural areas, Indigenous communities, immigrant and refugees, and people struggling with housing security, mental health, and addictions issues. We are proud to provide one more access point to primary care for the entire community, including these underserved and vulnerable populations through mobile clinics. Working with government, Newfoundland and Labrador Health Services plans to issue a tender for 2 vans to establish the first 2 mobile clinics. The vans will be outfitted with cabinets, stairs, IT needs, clinic supplies, equipment, and will have clinic assessment space and privacy. The clinic teams will be staffed by nurse practitioners, registered nurses, clerical staff, and family physicians, as already noted. We understand that there is a limited resource pool of healthcare practitioners. With this in mind, we plan to staff the clinics on evenings and weekends using existing staff so it does not impact current primary healthcare capacity. What this will do is provide these healthcare professionals the opportunity to explore a new work setting while supplying residents with another way to access primary care outside of business hours. The mobile clinic teams will provide non-urgent services to anyone who does not have or cannot access their primary care provider. They will assess and treat common ailments, provide education and awareness of chronic disease, prevention and management, and refer patients to other services or facilities when required. The first mobile clinics will be launched in central and eastern zones, the areas with the current highest demand. I'm excited to share the Central Zone Clinic will provide primary care services to rural communities. Initially, we are looking at rotating between 2 sites, New West Valley and Bay Verte. The Eastern Zone Clinic will provide services in both the rural and urban areas and may operate adjacent to the Health Science Centre as well as St. Clair's Mercy Hospital emergency departments. These locations will be used to redirect patients from the emergency departments who do not require emergency care. When the mobile clinic is located at a hospital, patients will be screened to determine the level of appropriateness for the service offered. If a patient requires a higher level of treatment, they will be referred to the emergency department. Similarly, a patient in the emergency department will be referred to the mobile clinic if necessary. By redirecting patients from the emergency departments, the mobile clinic will reduce wait times for non-urgent services excuse me, and ease the burden on the strained emergency departments. Excuse me. Newfoundland and Labrador Health Services will assess the success of these clinics and look to have additional mobile clinics travel to other areas of the province experiencing poor access to service, chronic disease burden, geographical limitations, and emergency departments where demand exceeds capacity. The mobile clinics will be a versatile and essential tool to continue to improve access to quality care across the province. We are incredibly excited and we look forward to inviting you to view them when we launch. I'll now turn it over to Dr. Parfrey.
Thank you, Melissa. So, the government's plans really that are announced today are all about improving access to care, and they involve a combination of bringing the care to the people and bringing the people to the care. So if you take the announcement on community care, there have been investments in family care teams, 811, and virtual care, and this is an innovative approach to improve access to primary care for patients who do not have a family doctor and have non-urgent care. And the other announcement concerning the updates about joint replacements is there is an example of bringing the care to the people in St. Anthony, and with Heart Force One, it is a solution to bringing the care from people who are isolated from the cardiac cath lab in St. John's, from Happy Valley Goose Bay, Lab Grenfell and Western Health, successfully bringing 70 patients for cardiac cath and being able to admit the patients who need surgery and discharge the patients who don't need surgery. And it amounts to 25% of the people who come in for the cardiac cath get kept in the hospital for surgery, and 75% can go home and no longer have to stay in hospital. So increasing access to both community care and to specialist care is consistent with the government's plan to transform and modernise healthcare in this province. And I suppose I'm here to advocate and to suggest that it's building on the recommendation of Health Accord NL. This work takes time, but action is being taken and improvements are being made. So I'll hand back to you, Minister.
Thank you very much. And I guess just to give a glimpse into, these are the first two. We will be working with the Provincial Health Authority to put an RFP out for additional units in the coming months with a focus on Labrador. One of the things that I will point out with Labrador is the need to co-design what this service looks like with our Indigenous partners, and that work will proceed now that this announcement is made with the hopes of getting a unit in Labrador in the near future as well. With that, we'll open it up for questions from the media.
So this is excuse me, this isn't like a summer relief thing, this is a permanent thing going forward, that you'll have these vehicles to the province, and as you said, you anticipate having more than two, and this is the way forward, I guess.
Yep, well, we know from today that there's going to be at least 4. These are the first 2. There will be 2 others tendered for in the near future, no later than the next budget cycle. And we'll look at need and demand for the following year on what's required. But these will be a permanent part of the healthcare system. As we continue to recruit health professionals and reduce the number of diversions at our Category B sites, the units will move on to the next location. But even if we get to a stage where there are no diversions at any of the Category B sites, if we have a family physician going on vacation, for example, these units will be required. Or if a nurse practitioner who's operating a family care team is off for whatever reason, these units can step in and fill the gap. So these will be a permanent part of the healthcare system into the future.
Is Melissa?
Yes.
Yeah, sorry, I don't if this is for you or the minister. You know, when I think of these medical vans, the first thing I think of is an ambulance. How is it structured? I assume it's probably structured differently though, right, than a typical ambulance would be?
Yeah, it looks similar to an ambulance on the outside, but it's structured very differently on the inside. As I said, they're completely retrofitted, and we're learning from other jurisdictions and our colleagues, particularly in the Atlantic provinces, around how we can do that. They have things like, IT is built in, as well as privacy screens and those types of things. So looks similar on the outside, but different on the inside.
Think of it as think of it as a doctor's office on wheels.
So they'll have access, I gather, to medical records and the tools needed to book referrals and things of that nature?
Correct.
Yeah.
And so, I know you referenced, the strain on staffing as it is, so that's part of this, but people will still hear that you're going to utilize existing staff, and they'll wonder, given the strains in every segment, whether it's after hours on weekend, they will still wonder where the staff are going to come from. Do you expect to have trouble recruiting?
Well, I think both myself and Melissa can answer this question. I'll answer it in part and then pass it over to Melissa. I mean, the Department of Health, the Provincial Health Authority, the recruitment office in both the department and Newfoundland and Labrador Health Services continue to recruit. We know, for example, we have 300 nurses coming from India. The first of those nurses should be landing in Newfoundland and Labrador. Well, I think there's already a cohort here, but the next cohort of those nurses should be arriving sometime in September or October, for example. We've announced today 4 new sites where we have physicians recruited. We continue to recruit, but in the interim, we will utilize existing staff who are willing to pick up evening shifts or weekend shifts to make these work. They will be staffed from 4 p.m. to 8 p.m. in the evenings and 8 a.m. to 4 p.m. on weekends. But as we continue to recruit and staff up within the Provincial Health Authority, our Category B sites, and the family care teams, these may operate at additional hours as well, as we're able to staff up specifically for these units. Melissa?
Yeah, thank you, Minister. So I guess the other piece that I would add is that this provides an opportunity for our current pool of physicians, nurse practitioners, nurses to work in a different environment, and that's what we heard from other jurisdictions, is that it is, it's an opportunity that if they work normally, 8 to 4, Monday to Friday, they can pick up shifts in something that, the public and the community are very excited about, and so it gives them that little bit of variety in their practice. I think it's important to note, as the Minister said, is it's not to pull from current capacity, and it doesn't take away from our recruitment efforts moving forward, but it does provide that little bit of variety in practice that we've heard is positive.
I think you referenced in the briefing earlier that they will be staffed obviously by medical professionals, and I guess some of us were just sort of thinking about a doctor or nurse practitioner driving a van. It may sound like a silly question, but is there any kind of special licensing or anything involved in operating these vehicles, or is me and you drive one?
Yeah, no, me or you could drive one. So if you're looking for a position to help out on these, just send in your resume.
Bring your camera.
Could you talk a bit about the plan for how patients will arrange to make use of these services?
So I think, Melissa, you're probably best positioned to answer, but I mean, it'll be a variety of ways, either in some cases by appointment, in some cases it'll be walk-in, so to speak.
Yeah,
so
sure. Yeah, so the exact mechanics of that we're working on right now, but to reiterate what the Minister said, it will be a variety of mixed appointments and walk-in. It'll involve a strong communication strategy, and so being able to communicate with communities about where these clinics will be located, when they'll be running, and working closely with communities to get the word out to to their residents so that they can access the clinic and that we can run the clinic as efficiently as possible. So it's a bit of both.
Parfrey, can I just ask you generally, first of all, not to leave you out of the conversation, but also, the announcements, of course, keep coming. This is another plan, 2 and 2 house, whatever they want to call it. Since all of this, embarked the health accord, where are we on the continuum? Where would you say? Are we getting there? Are we almost there? Are we showing improvement? Like, in your overall assessment, all of these initiatives that government have been coming out with, you know, is it making a dent? Where are we with all of that, and how pleased are you with it?
Well, I think that the two major proposals from the health accord were to rebalance the health system across hospitals, the community and the long-term care system. And the second one was to be aware and intervene in the social determinants of health. And I think it's very reasonable to say that the budget of 2023 was a health care budget, and it was consistent with a lot of the proposals that the health accord had recommended. And I might reference the family care teams that had massive financial investment, but they'll take time to develop. The health information system is getting a massive financial input. The ambulance system is coming together and being integrated. There are improvements being made in access. So I think that, and there are multiple other things that have been happening on the healthcare side. And then on the social side, I think that this year we're a bit behind in our thinking about how we can improve the social determinants of health. But I think this year that we will act on the social determinants of health.
When you say
So
we are behind, the government or the public in general?
Oh no, I'm speaking. I'm now a bureaucrat, on which is the most surprising thing of all time. But I'm speaking really about concerning the transition from health accord and L to the government's plans. So I think that's my kind of take on what the government's plans are.
I think, Brian, to add to that, you know, we, just as an example, I mean, and thank you for recognizing that we have lots of good announcements, but we were bleeding, let me rephrase that, we were hemorrhaging nurses from the system for a considerable period of time, and we've now stopped that hemorrhage. You know, the last count has been stable. There was a slight increase, but I will say it's stable because there was a slight increase in the number of registered nurses practicing in the province. With the tentative collective agreement, with the recruitment initiatives, including the one in India, for example, we'll see that turnaround. That's one example, but we are focused on, you know, all of these good announcements that you've referenced. Again, thank you for that. But all of these announcements are like pieces of a puzzle, and you can look at them as a single piece, but when you fit them together, there is an overall very deliberate, very focused plan where all of these pieces fit together. And you know, I'll give credit to Dr. Parfrey and Sister Elizabeth for developing the roadmap for that larger picture. But I mean, if you look at the pieces all combined, it is presenting a picture of a stronger healthcare system, a more stable healthcare system, and they all connect. You know, it is with focus that even this announcement is made today, because it is in conjunction with the family care teams. It is in conjunction with virtual primary care that will be up and running in the next couple of months. It is in conjunction with the recruitment initiatives that we have. And when we sit down and plan something like this, we layer what we're doing so that it all connects.
The healthcare system overall has a lot of people within it working hard, in some cases possibly being overworked. You've mentioned the initiatives that are in place to try and recruit more people into the system. In terms of the mobile clinics, what's your hope in terms of how to make it attractive for people as something that's, you know, an extra work opportunity that doesn't detract from the services that are already being provided?
I think Melissa hit the nail on the head, and I'll let her repeat what she said because it's a good message. But when I spoke with the minister in Nova Scotia, who have employed the same process, medical professionals are excited about the fact that, you know, they can kind of leave the office, so to speak, get out on the road, and it's a change of scenery, it's a change of practice, and they're willing to put in the additional hours. So it's not really a burden on the system because it's innovative, it's new, and it kind of gets them into a new scenery, a new environment, and people have been attracted to it. So Melissa,
Yeah, no, absolutely. And I think that's what we're hearing from healthcare providers is they want variety. The other piece is, there are, folks out there that are choosing not to work 8 to 4, whether it be for childcare reasons or, we're able to pull them back into the workforce with these types of opportunities. And that's incredibly important as well. So, I think, again, it's about variety. It's about being able to get into a new environment, something that is, is exciting and is positive for the community. And so, in a system now that is, under pressure, this is a very much a good news story.
excellent. Well, thank you very much, everybody.
Thank you.
Can I ask you
Yeah.
a couple questions just for some colleagues? Tom Bradshaw on the West Coast had done a story recently on, I think there was a woman from the United States that was a physician assistant, a term, I guess, or a type of career that we don't have here. Are you familiar with that position or that type of work, and is that something that could be utilized here in the province?
Yeah, so we've got a physician assistant pilot program that we've announced just a couple of months ago. One of those really good announcements Brian referred to. But
Tough luck, Brian.
so
Walked into it.
So we've announced a pilot program for physician assistants. We have 5 positions in the province, 1 in each of the zones where we have physician assistants. We are evaluating, and the Provincial Health Authority is evaluating the value that they bring to our system, how it will lighten the load of physicians, because a physician assistant can do administrative work so that a physician can focus on what physicians should focus on and lighten the burden on physicians by doing some of the administrative work. They can do surgical assists and so on. So we believe they will add value, but before we kind of run crazy and start hiring physician assistants, we're going to use this as a pilot so that we can properly evaluate and design what that position should be in the Newfoundland and Labrador Health Services, so that we get the best use of physician assistants. We just, for example, yesterday, I think with one of your colleagues, we gave a sneak peek into one of the other really good announcements we're going to make in September, and that's a pilot program for psychiatric nurses. So, that has been worked on. We're putting the pieces together. Within the next 6 weeks or so, we'll be announcing a pilot program for that, similar to the physician assistant pilot program, where that position, we can evaluate the best use of that position within the Newfoundland and Labrador Health Services. So we are looking at opportunities. We've just added 2 new licensures to the College of Physicians and Surgeons, working cooperatively with them to give the ability of physicians who hadn't previously been licensed or able to be licensed in this province, the ability for licensure. So we're looking very holistic at the opportunities and what's being used in other locations. I guess a sneak peek into, I've asked Central, Dr. Carroll in Central, to pilot a scribe program. And that scribe program, scribes are used in the United States. They're not really used in Canada. But they can also assist physicians. So we are starting a scribe pilot program, 1 position in Central, just to see if it's something that can be utilized here to ease the burden on other healthcare professionals and allow them to do, face-to-face primary care.
One other question from another colleague. They gave me a list. No, just one more. IVF, any update on the province and maybe getting that procedure here?
Yep, so it's something that, I'm very interested in, very focused on. We did put an RFP out in December. There was only 1 proponent came back. When it was evaluated, it didn't check all of the boxes, so they went back to the drawing board, re-tendering that RFP, hoping to get more than 1 response, or even if it's just 1, but more focused on what really needs to be done in terms of the RFP. I really want to look at, based on our population, demographics, the geography, what can and should be provided in terms of fertility services in Newfoundland and Labrador. But, you know, it's something we do need more services, but we want to get it right. So that RFP will ensure we get it right.
For the record, I may have made one brief reference to all of these, but I didn't speak to the success of them, for the record.
You were smiling. I'll take that as an endorsement.
This is more reference.
Yes, you live with silence, see?
All right. Thank you, everybody.
Thank you.